Hello everyone. I'm Ivan. I'm a clinical lecturer in old age psychiatry at the University of Oxford. To decode this means that I'm a medical doctor. So I work, half of my time I work with patients in memory clinics, and I also deal with situations where, for example, people have dementia and they have problem behaviours. So that's half of my time, and half of my time I work at Professor Lovestone's group that we heard about. And one of the things that I've been interested about is how can we harness the power of new technology that's developing exponentially in power to solve the challenges that we face today with dementia and that we'll face quite soon. So that's what I'll talk to you about. But let's first think about the way that the process runs day to day in my clinic. There's 3 stages of somebody having a memory problem. Very often people live with this. On average, my patients come after about 18 months of having some difficulties, but many more wait for quite a bit longer. What then happens is you go to your GP, and as you know, the process there is they have about 10 minutes in which what they can do is give you about 6 questions, and on that basis they figure out whether they need to refer you to us. That's usually now 2 or 3 months of wait for the person. When we see you, the appointment takes about an hour and a half, where the majority of the time is me or a nurse asking you questions about your memory, which, as you can imagine, isn't great when you're trying to establish what is the person's memory problems if you're relying on their recollection of what the memory is. So sometimes we rely on relatives, but I think we have to be frank that it can be an ineffective process. And then what we also do is we do, again, some testing, pen and paper testing. That's similar to the one the GP did, but slightly longer. And what I'm going to argue is that this is a process that unfortunately is ineffective, it's imprecise, and it's costly. Starting with the precision, it's imprecise because it's done on a single occasion. So we see you after you've had this complaint for 18 months, we get an hour, we do it there and then in the clinic. Some people do better than others, just in this sort of unusual environment. It's also, as Marianne, for example, was saying, some of these tests, are not a one-size-fits-all. Her mother was able to do one of the tests quite well, sort of very late in the disease. While I see people who do the same test very badly right at the onset. So some of these are a poor one-size-fits-all measure. And also, we only test the memory over a very short space of time, so maybe 30 minutes. I give you some words to remember, then I ask you again, usually within 10 or 15 minutes. So that's the sort of time span we're working with. It's ineffective because at the end of these appointments, especially if you don't have dementia, there's some brilliant advice that we give you that Robin talked about, taking care of your heart, but also quite importantly, maintaining good enough levels of activity. We know that the people that age slower, the people that stay young, are the people who, have high level of intellectual activity. It's the people who read books versus the people who watch TV. It's the people with reasonable levels of physical activity, the people that walk every day, and it's importantly the people who stay active socially. The people who keep meeting friends are the people who age so much slower in terms of their brain health compared to the people who suddenly get isolated at the age of 70. So these are brilliant things, but we know that this means a lifestyle change. How easy is it to make changes to your lifestyle when you're 70? It's difficult for me when I, for example, try to cut out something simple like coffee. So to make some huge changes are difficult. In fact, we know from research that it takes about 12 weeks for people to get a new habit, and it's hard work. So very often we give the advice, it's brilliant, but it's ineffective in how good we are at following up. And it's costly. So we saw how much time it takes to get to the memory clinic. Very often you have to go back to the GP, then back to us again. And it involves a lot of time for people that need the help and for the healthcare. So these are the challenges of today. And this is a very important graph. sometimes the simplest things carry the most powerful message. What this is it's the population pyramid of the UK 2 years ago. So this is just a representation of where the population is in terms of their age. On the left in blue you have the men, on the right in red you have the women, and each bar represents a different age group, starting from the people on the bottom who are the youngest, going all the way to the people who are lucky enough to be 100 or more. And so what you see immediately is that we have a problem. There is a bulge of people, so that the more you are to the left or the right, the more people we have. There's a bulge of people around the age of 45 to 55. And we're now living longer. We know that this bulge is going to go only one way. In 20 years, these people are going to be 70 or 80. So this bulge is suddenly going to be in people who are elderly. And being elderly is the most significant risk factor for dementia, just age on its own. And another thing that is going to be a problem is that we know that another thing happens that when you hit 65 is that people move away from the busy cities and they move into the countryside, which is understandable. But it makes healthcare delivery more difficult because the major health centres are in the cities. So suddenly we have this additional cost, both just in practical means, but also just for the cost of getting to the different locations, which compounds to the problems that we have with the way that we diagnose dementia at the moment. So, what can we do? How can mobile phones help with this? Mobile phones are amazing. So, they're essentially a super powerful computer. They have 1.6 billion transistors in each one, which is excellent news if you're the type of person who likes transistors. But also, it's, in practical means, it's 120 times million more powerful than the spacecraft that was required to get us to the moon. So each one of us carries these things in their pocket. And not only carries it every now and then, people from, that use this every day, you find it embarrassingly, you take this absolutely everywhere. So it's always with you, it's very powerful, and it's also got a number of other sensors, so you can track the number of steps that you take. And it can link to a number of other different devices. And it's super common. 80% of the Western population have a mobile phone nowadays. And it's projected to rise even higher by the time we hit this bulge that I'm talking about. So what is it actually useful for? What have we developed using this super powerful computer that everybody has, bought with their own money, by the way, so there's no investment from the healthcare service. The first thing is what's called active monitoring, and then we'll go on to passive monitoring. So active monitoring requires you to actually fiddle with the phone and do things. One of the things is quite simply an application that we've developed at the University of Oxford that tests your memory. What this thing does, it shows you pictures of household items. Here we have a basketball ball. And what you have to do is learn which way the basketball is going. So is it going up, right, or left? So simply associating the object with the direction that you're interested in. It's going to be animals, it's great fun. So what is happening is that then you're free to test people on multiple occasions. You can test them as many times as they're willing to engage with the task. You can test them in their own environment. Suddenly we've got rid of the issue that some people may do better in the presence of going into a hospital versus others who are quite comfortable. But most importantly, I think this is the critical issue. It allows you to break away from having to test the memory after a 50-minute delay. You can now test people up to 8 days after you've given the information. And this is, I would argue, critical when you're trying to go beyond identifying people who are clearly in the dementia or the near dementia stage, but it allows you to look at people much earlier than that. What we didn't talk so far is that we now know that dementia starts up to 25 years before first symptoms. This is when these proteins start to build up. And if we're going to find a way to develop some sort of an intervention, we have to have a good way of finding these people in these what we call preclinical stages. So this is one of the ways. So this, for example, is 2 lines of people, depending on their testing. On day 1, they had a nearly 100% success at remembering things. And then once you start testing them at day 1, day 3, day 5, day 7, people start to forget. That's just a normal thing. But what you can then do is you can find out at what point does this person forget 50% of what they used to remember. So for the people on the green line, it was about day 4. For the person on the red line, it's about day 6. So suddenly, you get a lot more data about what is normal for this person. And if you do this long enough, then you can see that the red person who was able to remember things for 6 days, if they do the test long enough, suddenly you see a trend. You see that they're able to now remember 5, 4, and shorter days in terms of duration, which is extremely valuable in the earlier stages. The other ways in which you can do active monitoring is simply through having, if you like, digital diaries of what's happened to the advice we've given you about the activity, about the control of the heart risk factors. And there are studies that show that if you have this way of active monitoring and stimulating people, suddenly it becomes a lot easier to make these lifestyle changes rather than relying on people just to have this one-off advice once in a year and then be left to do with it. Somebody's actually giving you and saying you're not doing very well on the social activity side, go and try. The next week you haven't done it again, they ping you again. And that is going to be critical. We know that lifestyle change isn't easy, and that may be one of the ways in which we can help. The second way in which mobile phones and mobile technologies can help is through passive recording of data. So the previous ones, it will involve active interaction with the phone, specifically with the app. These ones, they take advantage of the phone's ability to record information automatically. And it can record an amazing variety of things. It can record how quick you are when you're looking for somebody's name, how good you are at picking up the words that you need in a text message, or how long your text messages, or the vocabulary that you use, which we know is one of the first things that goes in Alzheimer's. People's vocabulary gets smaller. Or how good you are after unlocking your phone at finding out what was it that you were meant to be doing. So little subtle things like these. You can interrogate the data. You can either do this by knowing exactly what you're looking for, or you can collect this huge amount of data and you can do something called machine learning. You can teach a super powerful computer to look at the data and you say, this is the data of people who are normal, this is the data of people who are not definitely at risk, this is the data of people who we know have Alzheimer's. And then the computer, just looking at this huge data, is able to come up with signatures for the different types of person, so that once you have a data for somebody else who you don't know where they belong, you apply this signature to the data, and then it can guide you. This looks like somebody who may be at risk. Okay. 2 other things. The other thing that the mobile phone can record is GPS data, so signal from the satellite, and it can essentially, if you allow the phone, it can track your movement. And it can do 2 exciting things. One is navigational ability, how good you are at finding your way around the city. Are you turning back to find your way, while before then it was just a straight line? We know that navigation, again, is one of the first things that starts to change in dementia. People are not as able to find their way effectively. Or the other one is something like this, which is a map. And if you collect enough data, you start to realize that some types of activity are associated with particular bits of the town, for example. This is the part of town where the person goes for leisure. This is the one where they go to, pick up their grandchildren or something else. And then what you do is you create a pattern of their activity. And again, with these super powerful computers, you can then prime it to look for changes in the patterns. Maybe it is that they're not spending as much time in pleasurable activities. Maybe they're not being out of the house as much, which again we know happens very early. Before people realize beyond the memory, it's other small, softer telltale signs. They're not as active as they used to be. So this can again help. And the last thing that again we're working with people at Oxford is in the abilities of these machines, so be it smartphones or smartwatches, to link up with other devices. In this particular project that we're working on, we have what's called Bluetooth beacons. So these are very small devices that you can place around the house. And what they do is they talk to your phone or they talk to your smartwatch each time you move about. And at the end, it can give you two types of information. One is, what is your movement around the house? Again, do you find that you're going into a room, but then you're going back into the same room again, perhaps as a sign that you went into a room, but you're not quite sure why you went there? Or you used to spend 3 hours a day in the kitchen, but then suddenly you're spending an hour and a half in the kitchen, and you're spending the majority of your time in the living room, perhaps not doing much. Is a sign that your function has started to change. And the second type of information is that if we create a lot of information, then we can start to just create, if you like, a map of movement around that. This is the Schmoden Museum in one of our pilots. As you can see, this is just somebody moving around, and it creates this beautiful map of your movement. And again, if you have this information for a while, you know what is the usual pattern of movement, and you can prime sort of an automatic way of detecting, just saying, hello, there's a problem, there's something changed about this map, we don't know what, but something is changing. And again, have this as a way of sort of flagging up trouble. So going back to the original problems of precision, I would argue that these methods have the possibility to be much more precise because they allow more frequent testing that spans over multiple days. It's potentially a way to increase effectiveness through building in reminders that people should be doing something else. And it's potentially less costly because now you have to go through all of this process to come and see this, but actually you could, for free, generate a lot of data that is much more useful rather than having to come back to the clinic year after year for these one-off assessments. And the final question is, so what? If you're able to diagnose things earlier and more efficiently, how does this help? One, we make the, if you like, the NHS process leaner, but more importantly, something that we were talking about in terms of drug discovery, is we need to find a way to essentially identify people as early as possible. We saw on this beautiful map that you showed us about the different compounds. So there's already drugs that we think may be effective in Alzheimer's, but all we can test it at the moment is in people who already have the disease. So just because something has failed in somebody who has developed the disease, does it mean that the same medication, if it was given 50 years before then, wouldn't have been effective in preventing it? The only way to find out is by identifying people at the earliest stages, and this may be one of the ways to do it. Thank you very much.